It's 2 a.m. You've fed her. You've changed her. You've rocked her, bounced her, shushed her, and she is still crying. And you're sitting there thinking, what am I doing wrong? Here's what no one tells you: there is no such thing as a baby who just cries. Every cry has a reason. And once you learn to tell them apart, everything changes. In this video, I'm going to walk you through the 5 most common reasons babies cry non-stop, and exactly what to do for each one. By the end of this video, you'll feel so much more confident, because you'll actually know what your baby is trying to tell you. Let's get into it. Type 1, hunger cry. The most common reason a newborn cries? Hunger. And it might be happening more often than you think. In the first few weeks, babies have tiny stomachs, about the size of a marble at birth. That means they need to eat every 1.5 to 3 hours, around the clock. What it sounds like: a hunger cry usually starts low and rhythmic, almost like a repeating pattern. Wah, wah, wah. It builds louder the longer you wait. What to look for before the cry even starts? Rooting. That's when your baby turns their head side to side and opens their mouth like they're searching for something. Bringing hands to their mouth. Lip smacking. These are your early hunger cues. Catch them here and you can feed before the crying even begins. What to do: feed them. If you're breastfeeding and worried about supply, feed on demand, your body adjusts. If you're formula feeding, check that the amount is right for their weight. A pediatrician can guide you on exact ounces. Pro tip: if your baby seems hungry again immediately after feeding, they might not be latching deeply enough. Or they may just need to be burped. A trapped air bubble can feel just like hunger. Type 2, gas and tummy pain cry. This one is so common and so easy to miss. Gas pain in babies is real. Their digestive system is brand new and still figuring everything out. What it sounds like: a gassy cry is higher pitched and more urgent than a hunger cry. Your baby may clench their fists, pull their legs up toward their belly, or arch their back. Their tummy may feel hard or look slightly bloated. What to do: first, burp them, even mid-feed. Sit them upright, support their chin, and gently pat or rub their back. Don't wait until the end of the feed. Second, try the bicycle legs. Lay baby on their back and gently move their legs in a cycling motion. This helps move trapped gas through the intestines. Third, a gentle tummy massage. Using 2 fingers, make small clockwise circles on their belly. Clockwise follows the direction of the digestive tract. One more thing: if you're breastfeeding, consider whether something in your diet, like dairy, caffeine, or cruciferous vegetables, could be contributing. It doesn't affect every baby, but it's worth tracking if the gas is persistent. Type 3, overtired cry. This is the one that catches new parents the most off guard, because it seems backwards. How can a tired baby not sleep? Here's what happens: when babies miss their sleep window, their body releases cortisol, a stress hormone, to keep them going. Once that kicks in, it becomes incredibly hard for them to wind down. They're exhausted and wired at the same time. What it sounds like: an overtired cry is often intense, almost frantic. It doesn't have a clear rhythm. Your baby may rub their eyes, pull at their ears, or stare blankly. They might fight sleep even while clearly exhausted. The key is catching the tired signs before the overtired stage. Watch for yawning, slower movements, glazed eyes, or losing interest in what's around them. That's your window. What to do: create a wind-down environment immediately. Dim the lights. Reduce noise. Swaddle them snugly. White noise is incredibly effective here. It mimics the sounds of the womb and triggers a calming response. Hold them close and keep your movements slow and rhythmic. Don't try to play or stimulate them. The goal is to lower their cortisol, not add more input. Newborn wake windows are short. In the first 6 to 8 weeks, most babies can only handle 45 to 60 minutes of awake time before they need to sleep again. Track it, and you'll start catching that window every time. Type 4, overstimulation cry. Your baby's nervous system is still developing. Bright lights, loud sounds, too many faces, too much handling, it can all become completely overwhelming in a matter of minutes. What it sounds like, an overstimulation cry often comes out of nowhere, especially in busy environments. Your baby might turn their face away, arch their back, or become suddenly fussy after seeming fine. What to do? Remove them from the situation. It's that simple. Take them to a quiet, dimly lit room. Hold them against your chest so they can hear your heartbeat. Stop talking. Stop bouncing. Just hold them still and let them decompress. This is also why some babies cry more at the end of the day. They've been taking in stimulation for hours and they're full. It's called the witching hour, and it's completely normal. What not to do: don't try to soothe an overstimulated baby with more stimulation, more bouncing, more noise, more singing. Less is more here. Type 5, colic. And then there's colic. If your baby cries for more than 3 hours a day, more than 3 days a week, for more than 3 weeks, and nothing seems to help, that's colic. Colic affects about 1 in 5 babies. And the hardest thing about it is that there's no single cause and no guaranteed fix. But there are things that help. What it sounds like: colic cries are intense, high-pitched, and seem inconsolable. They often peak in the late afternoon or evening. Baby may clench their fists, curl their legs, and turn red. The 5 S's by Dr. Harvey Karp: swaddle, side or stomach position, shush, swing, and suck. Used together, they can trigger a baby's calming reflex. Probiotic drops, specifically Lactobacillus reuteri, have shown some promise in research for colicky breastfed babies. White noise machines on a consistent setting. A warm bath sometimes helps relax the abdomen. Skin-to-skin contact. Most importantly, colic is not your fault. It does not mean something is wrong with your baby. And it almost always resolves on its own by 3 to 4 months. If you're reaching a breaking point, and it's okay to admit that, put your baby safely in their crib and step away for a few minutes. A calm parent is the most important thing your baby needs. So let's recap the 5 types of cries. 1. Hunger. Feed them, watch for early cues. 2. Gas and tummy pain. Burp, bicycle legs, gentle massage. 3. Overtired. Catch the sleep window early, use white noise. 4. Overstimulation. Less is more. Quiet room, still hold. 5. Colic. Not your fault. Use the 5 S's, be patient with yourself. You are not failing. You are learning a brand new language, your baby's language. And the fact that you're here, trying to figure it out at whatever hour it is right now, that makes you a great parent. If this helped you, please give it a thumbs up, it genuinely helps other exhausted parents find this video. And subscribe for more guides just like this one. You've got this.